is Samantha Nava, and I'm doing my primary health issue on reducing the risk of heart disease through nutrition. Before I begin, I actually want to apologize for being super close to the camera. We're having some connecting issues with the microphone, so I have to be this close in order for it to read my voice. Okay, so let's go ahead and get started. I will try to talk really loud. So as part of our presentation objectives, so the topic, like I mentioned before, so we're going to discuss summary issues, current events or hot buttons. We're going to talk about relevant risk factors, prevention techniques, specific components of health affected, specific applications in relationship to public health, relevant strategies currently being utilized, and potential alternatives. So let's go ahead and get started. Okay, so as far as disease is actually the number one leading cause of death in the United States. About 100,000 people die of heart disease each year. One of the most common types of heart disease, actually, let me back up. Heart disease is actually the umbrella to other heart diseases out there. So one of the most common one is the coronary artery disease, which affects the blood flow due to blockage in the coronary artery. Um, so some other issues would be obviously living in an unhealthy lifestyle, that smoking, excessive drinking, a stressful environment, living an unphysical lifestyle, also eating unhealthy. These all increase our risk for heart disease. Um, So the chances of someone being diagnosed with heart disease can be reduced if lifestyle changes are made. So again, if someone changes their current lifestyle to a more healthier one, their chances are reduced of getting heart disease. And again, one of the ways that heart disease can be reduced is through proper nutrition. Okay. Okay. So some of the current events. So why this is such an issue for the public is that, like I had mentioned, it is the number one cause of death in the United States. It has so in the U.S. alone, in 2017, 600,000 people had died from heart disease. Um, Globally, 17.3 million yearly deaths are related to heart disease. And then coronary artery is, again, one of the most common ones, kills over 300,000 people annually. Um, so the second reason as to why this is such an important topic is also because it is costing the healthcare system so much money, and what is I would say sad is that this is actually a preventable disease if it's not hereditary. Okay, so again, if it's not hereditary, this is a very preventable disease, but unfortunately, it is costing the healthcare system um, more than $200 billion each year. And this includes healthcare services, medications, and loss of productivity. Um, and then people ages 45 to 64 spend over 48 grand if they're diagnosing, and patients 65 and above spend 51 grand. Again, imagine saving all that money if you just simply change your lifestyle and you simply eat more healthier and are more health conscious about how you're treating your body. So again, all this can actually be prevented if it's not hereditary. So the potential impact it has on health is it can lead to heart failure, it can lead to heart attacks, a stroke, I'm sorry, aneurysm, peripheral artery disease, and even cardiac arrest. So again, if the heart disease is not treated immediately, um, or if there's no lifestyle change, it can lead to other greater symptoms. So some of the risk factors. So poor diet is obviously one of them. People are eating too many trans fats, saturated fats, foods high in cholesterol. All that is definitely having increasing the chances of obtaining heart disease. physical inactivity, so not exercising. Sorry. Age, usually people ages 40 and above are more higher risk of getting heart disease. Sex, so typically males have a higher risk of getting heart disease. Family history, so again, this is kind of going back to genetics. So heart disease sometimes can unfortunately be passed hereditary. Smoking, high blood pressure, high blood cholesterol, obesity, all are risk factors that can contribute to heart disease. So prevention techniques. So again, it is very important that change begins through nutrition. So we need to minimize sugar drinks. This is in drinks and foods. The salt intake, whether minimize the salt intake or no salt intake at all if possible. Avoid any trans fats and saturated fats. So these could be like your French fries, and also lowering the alcohol consumption. And what we should be adding more to our plates would be more fruits and vegetables, more whole grains, foods high in fiber. Consume more fish rich in omega-3, and these would be like your salmon and your tuna. And also drinking more water. And again, these are all prevention techniques. So specific components of health affected. So depending on the type of heart disease, affect the body very differently, and also depending if you're a male or female. So typically, if you are not receiving enough oxygen to your heart, and again, oxygen is delivered through blood flow, then you will get chest pains. If you have an irregular heart pump, you will feel more kind of like short out of breath or feel more tired than usual. Heart attacks will occur due to the buildup of plaque. And again, typically men have more an intense chest pain. Females, it's more of a tightness and pressure. But then they also feel more tired and more short of breath and have feel nauseous. And this can also affect your daily life, like going up the stairs. You might feel short out of breath. Just walking from your car to the front of your door. Little things like this will have an effect on your everyday life. So I suppose some specific applications related to public health. So we have the CDC. So this is the Center for Disease Control and Prevention. So they have a website where you can pretty much they have a lot of the big diseases on there that you can look up, and they have tons of information as well as resources if you need more information or if you need to contact a hospital or someone who can help you or the person that you're trying to help. The American Heart Association is one of the big ones, so they cover everything heart related. So they have a lot of statistics, a lot of information as to how to prevent heart disease, what to do if you have heart disease, and who to contact. So American Heart Association is the big one. The Heart Foundation is another one. I would say this one would be second to the American Heart Association. Very similar, a lot of resources, lots and lots of resources, and a lot of people that someone can contact for more information or to get help. So as far as relevant strategies that are utilized, so there's two types. They're using interventions and then they're also using medication. Typically, if someone is already suffering from a heart disease, they will start them on medication. And again, it just kind of depends on how severe the heart disease is. Again, medication can include anything from aspirin therapy, beta blocker therapy, the clot buster drugs. I'm not going to read all of them, but these are all different types of medications that a doctor can may put you on, or someone who's suffering from heart disease. Interventions, CPR. We all know CPR usually when someone suffers a heart attack. You want to begin CPR, bring out the AED. They also would add pacemakers for people who need to have a permanent pacemaker in them. So it's kind of, you want to think about it almost like an AED that they have inside that would shock them immediately if the heart goes into VFib. And then heart transplant. getting a new heart. So, like I had mentioned, nutrition would be the number one alternative to begin with if you are at risk of heart disease or are suffering from heart disease. But other alternatives are being physically active. So, this want to always contact your doctor first if you are currently suffering from heart disease, just so they can let you know and advise you how many days and how intense the workout should be. Maintain a healthy weight. So again, this can be done through eating healthier, making better healthy choices, and exercising as well. Quit smoking and avoid the use and exposure to tobacco products. So smokers are a very high risk of heart disease and other diseases that are connected to smoking as well. So um, again, if you know somebody or if you are smoking, best to stop for the sake of your health. Maintain normal blood pressure and cholesterol levels. And again, this all can be done through exercise and proper nutrition, and reduce and manage stress. This is a tricky one because sometimes we work at jobs that are very high in stress, but we have to learn how to cope with them and how to manage them so they do not affect our health in a negative way. And this is the end of my presentation. These are my resources. Again, thank you so much for watching, and I apologize for having my face super close to the camera here. Again, thank you so much for watching, and have a great